Hello guys, again this is Simple and Drill Isaac. Karibu sana to my channel. Leo nataka tuongelelee kuhusu how to prevent TB infection in our community or in our society. Usually tunasemaga ndio mtu the main symptoms that a person present with when you're having TB. One of them is usually cough that is persistent over a period of more than a week. But currently, we are saying every day that if you feel you are coughing, and even if it's one day and you are not comfortable with the cough, uh, that one is an alarm. You should be tested. Cough of any duration. The other thing, when you suspect you're having TB, is drenching night sweat. Drenching night sweat, in a layman's language, we say is when you sleep and then you wake up, you find yourself you have a lot of sweating in such a way that even your pants are sticking in your body. That one is not normal, especially if you are not used to sweating so much during the night that in such a way that your your night dresses stick to your body. The other one is significant weight loss. Maybe I was wearing maybe size 32, and now even my boxer, which is size 30, is not fitting me. That is a sign that I'm losing weight significantly, and I should be tested for TB. Now, one of the reasons, that's one of the reasons that you should be tested for TB. Now, for us to be able to prevent TB from in our community, one of the things is let's take our treatment for those who have been tested and started on treatment. Please make sure you have completed your treatment as prescribed by the clinician or nurse or any other healthcare worker you found in the facility. Complete your dose of treatment and get all the tests as required by your healthcare provider. For those who have contacts with or who have interacted with persons who are suffering from tuberculosis or those who are on treatment, please visit in a health facility, be tested for tuberculosis, and be started for TB preventive therapy, the TPT. It's available, and it's free of charge in government facilities and even private facilities that offer TB preventive therapy. It's usually free of charge, and you'll be able to take it. For adults, they take it weekly for 3 months. For children, they take it daily for 3 months. And with that, you'll be sure that you'll not be spreading TB in your society, and you'll not be the next victim who will be diagnosed with tuberculosis. The other thing, we need to have good ventilation for those who are living with persons who are suffering from tuberculosis. Do not discriminate them or stigmatize them. Give them ample time so that they can be able to take their treatment to completion. And always make sure that for those who are taking treatment for tuberculosis, have a let them live in a well-ventilated room, place with ventilators, windows open, let the door be open so that at least the room can have a good circulation. For those who can be able to ambulate, during the day, let them stay outside and enjoy the cool environment. And with that, they will not be able to stay in a staffed up place where they'll be emitting the bacteria, and the bacteria will be roaming around that house. So let them have ample time to be able to enjoy the outside environment, and let them go to bed when it's necessary, or when maybe it's evening and it's becoming a bit cold. That will help as they improve up. They even also feel better interacting with other people in the outdoor environment. The other thing, for those for those who are living with HIV, always make sure that you have been treated for latent TB infection or be given TB preventive therapy while you are being started on your ARVs. It will prevent you from progressing to active TB if at one given point you had the latent TB infection. With that, I think that's awesome, and that's a good advice for us. And let us continue educating the community, educate your friend, let your friend educate her friend, and let us spread the gospel so that we can be able to prevent TB infection and growth of TB infection or new incidences of TB infections in our community, and that our people may be able to live healthy. Remember that the TB drugs that you receive from the government free of charge, they come from taxpayers' money, and if we can be able to reduce the cost of, we can be able to prevent TB. We can reduce even the amount of, we can be able to reduce the amount of expenses incurred by the government in purchasing these drugs, and that will be a positive impact even to when it comes upon even the development of our health facilities and other places that are that money that is used to treat the next person can be directed to other things that can be able to help our society. Even the money can be directed to even educating the masses more on living healthy and better life. Thank you. And also the other thing that I forgot. So when you're living with person with TB infection, give them good diet and encourage them to be able to complete their treatment. Let them not be your babysitters when they're having active TB, so that we do not risk our under fives from getting a TB infection. And even for those under fives, they should be also be given TB preventive therapy to prevent them from progressing to TB infection. And I think with that, we'll be able to live a more healthy environment, and we'll be able to enjoy our life in a more better way. Thank you, and kindly remember to like, subscribe, and share. Let more people be able to know and get to know about this channel, Puma Health Solutions. Or you can also call me Mkurugenzi Maish. I'm a daktari. Bye bye, and God bless you. Hello and welcome to my channel. This is Isaac, Simple and Real. Karibu sana to my channel. Please remember to like, subscribe, and share. Let more people get to learn about this channel, and let us continue empowering our communities, continue encouraging our community to know more about HIV and to know the opportunistic infections and how to prevent them. Karibu sana. Please do not forget to subscribe to my channel for more of this as we continue empowering our community to be able to live better with HIV, and those who have not yet gotten HIV, how to prevent themselves from getting HIV infection. Karibu sana. Today, nataka to learn about latent TB infection. What is latent TB infection? Latent TB infection, in scientific terms, we say it's the persistent immune response to stimulation by Mycobacterium TB. Now, as we say, in our community, we have so many kind of people. We have people who are HIV positive, we have people who are HIV negative, and we have other people who are immunosuppressed, and so many kinds of people in our community. Now, for those of us who are TB positive, or they are smear positive, or they test positive for TB through the sputum, before they get their treatment, they already have the bacteria, and whenever they are coughing, whenever they are laughing, they emit these bacteria to the air. Now, for a person like me and you who do not have tuberculosis, when we interact with them or we interact with the surrounding where they are laughing and coughing, we tend to inhale these active bacteria from the air. Now, when we inhale these bacteria, because our immunity is competent, we tend not to get the active TB infection. However, even after us having the bacteria and the bacteria being dormant in our bodies, our immune response tends still to detect them, but yet they do not replicate in our bodies, so we do not become clinical, or we do not emit, or we do not show the signs and symptoms of a person with TB infection. But however, when we are tested, maybe the IGRA test, where we test blood for tuberculosis, it shows positive for TB. When we do tuberculin skin test, it shows positive for TB. This is because when a bacteria is in your body, the body tends to produce antibodies against that bacteria. And since these bacteria have hidden themselves somewhere in your body, they are not destroyed, but yet the antibodies detect them. However, they do not replicate because they are suppressed by your immunity. And this is what we call latent TB infection. Now, when someone with latent TB gets an immunosuppressive disease, let's say cancer, TB, or not cancer, or maybe HIV. HIV, we say that it's a condition, or it's a virus that suppresses your immunity. Human immunodeficiency virus. Nakumbuka? Good. Now, when you're having this kind of virus, or maybe you're having cancer, your immunity gets suppressed, because especially for cancer, because of the drugs that they do take every day, or maybe at a certain period of time, they tend to suppress their immunity. Now, in this case, this latent TB will start replicating, or the virus will start to grow, or the bacteria will start to grow, because your immunity is compromised. And in this case, that's when someone presents with active TB. So when latent TB is not treated and someone ends up getting an immunosuppressive disease, they tend to progress to active TB. However, if your immunity is competent throughout, you will live with latent TB till you die without discovering that you ever had latent TB. However, it is always good to take caution and to be tested, and so that you can be treated of latent TB. Now, let us get to understand more about latent TB. This kind of tuberculosis is we usually take it very seriously, especially to HIV positive clients, because as I said earlier, HIV is an immunosuppressive virus, and having the virus, we tend to take care of you so that when you are HIV positive, you may not progress to getting TB infection because of this immunosuppressive virus that you're having in your body. Now, latent TB is a treatable bacteria, or is a treatable infection that is asymptomatic, and we usually treat it for 3 months. For adults, and for children, it's usually 6 months. Also, we prevent those who are TB contacts, or someone who is having maybe a family member, or maybe a friend that you are taking care of, or maybe you are a healthcare worker. You should be treated for latent TB infection, because you always come across this bacteria now and then, and the more you get this latent TB, the more it gets out of hand and you progress to active TB. So, despite we said earlier about the immunity, also the number of bacteria in your body at a particular given period of time dictates whether you will progress to active TB or not. So, especially for a healthcare worker, or as a person who is taking care of someone who is suffering from TB, that is the smear positive or sputum positive tuberculosis, when you are taking care of such kind of person, you will be getting this bacteria now and then on daily basis, because this person is coughing daily, and if your house is not well ventilated, the bacteria will storm in your house, and you'll be inhaling it on a daily basis. So you are one of the candidates who should be treated for latent TB infection. The other person is all healthcare workers, because they interact with these clients on a daily basis. The other person is a person living with HIV, because especially for those who are newly diagnosed, the main reason is now, since the virus that you had, because you did not acquire the virus the day that you are diagnosed with the HIV. You acquired earlier. That's why your antibodies could detect that you are having the virus. So your immunity has been drastically going down, and this is a risk, because if you had latent TB and your immunity is going down, the latent TB might progress to active TB. So in this case, you need to be initiated on TB preventive therapy. TB preventive therapy is a treatment. Usually we use two drugs, isoniazid and rifampicin combination, and it's usually treated for 3 months. For kids who are for those young kids, it's usually given that they receive prophylaxis for 6 months. No. Now we are doing for 3 months also. So for adults it's 3 months. For children it's 3 months. For children, they take their drugs on daily basis. For adults, they take their drugs on weekly basis for 3 months. The drugs are very convenient, and you just have to choose your day. Their side effects are very minimal, so do not fear to take them. And it's always better to prevent than to cure, because when you get the infection, you'll be treated daily for 6 months, or probably maybe for 1 year, depending on the site where the infection has taken place. But if we can be able to prevent it from happening, you'll only have to take the preventive therapy once per week for only 3 months, and you'll be sure that the likelihood of you progressing to active TB is almost nil. Sawa sawa. So karibu sana to my channel, and kindly remember to like, to subscribe, and to share as we continue to educate the society on the best way to live, prevent ourselves from getting TB infection, because TB kills, but TB inatiba, na unaweza tibiwa pia. Tunaweza zuia TB tukiungana pamoja, sawa sawa. So karibu sana to my channel, and do not forget to subscribe to my channel, like, share, and let people know more about how to prevent TB, how to get diagnosed to be checked for latent TB infection. These tests are available, and they can be done in the public facilities, or maybe some private facilities. This test of blood, the IGRA test or tuberculosis skin test, they can also be done. But the most necessary thing is, how best can you prevent yourself if you have engaged in a risk? One of the risks, we said, either you are having an immunosuppressive virus like HIV and AIDS, or another risk is, have you gotten a contact or a TB positive or a smear positive, someone whose sputum presented positive for TB? Have you been started on TB preventive therapy, so that you can be able to be prevented from also getting active TB infection? So kindly consider that very important. And as I say always, being positive about HIV is not necessarily being HIV positive. I love you, and God bless you as you continue to subscribe to my channel. Bye bye.